Now, here's the cool thing. If you have neuropathy, pins and needles, even if you have numbness, this is a reversible problem. It's not permanent. Well, until it becomes permanent. If you wait too long, it becomes permanent. But especially early on, it is reversible. So there are several things that have been shown to reverse this. Many of you have tried Nervala, which is our supplement that contains the two supplements that have been used to reverse diabetic neuropathy. One is Alpha-Lipoic Acid, and then also the other one is a benfotiamine, which is vitamin B1, but that's only a part of the issue. Some people think that they're just going to pop a pill and all of a sudden their neuropathy is going to get better, and many have. But it's so much better if you're working on the program. If you're doing the Diabetes Solution Kit, you're doing the diet, and you have very low carbohydrate diet, you're getting your blood sugar down, then you're not doing damage to the lining, and your insulin levels are going down so that you can get sugar into there, so things will start functioning better, so the nerves will start functioning better. So.
And I'm going live here on Facebook as well. Hello, everyone. Welcome to the Fixed Blood Sugar webinar. We are glad that you guys are here. We have Joe, myself. Oh, actually, it probably doesn't look like that for all of you. Joe, yeah. Dr. Saunders, and me. Welcome. I'm Leslie. If you're new here, you have arrived at the Fixed Blood Sugar webinar, where we talk about type 2 diabetes. We also take your questions, and usually every other week we focus in on a specific topic related to type 2. And today we are going to be doing just that. So one of the questions that comes in often from many of you who are viewing is, what is going on with this pins and needles feeling that I'm getting? Or what can I do about it? Or what does this mean? And so we're going to talk a little bit more about what that is, what we can do to prevent it, what's going on in the body, and all of that kind of stuff. So, but before we get started, just a quick little disclaimer. I'm going to have Dr. Saunders do that for us.
Okay. The information that we give here is not for you specifically, but it could be. It is for general information. So make sure that if you hear something, and that even if it sounds good, make sure it applies to your case, because not everybody has the same problem. Even people with neuropathy. We're going to talk about neuropathy today. And some people have neuropathy because of diabetes and the blood sugar. But other people with diabetes have neuropathy because of toxicity, and it's completely different and a completely different problem. And so it's a specific treatment or cause or effect may not apply to you specifically. So it's important to take your individual case and look at and see if it applies to you.
Very good. All right. So with that, guys, feel free, if you are on the Zoom webinar, if you're using Zoom, you can type your questions into the Q&A. That's the best place for me to manage those. If you're on Facebook, go ahead and post those in the comments. If you have not joined our webinar, if you're not getting notifications about it, you can go to bartonwebinar.com and sign up to get notified about these. We do this every week, same time. I think we are on 157. I think is the number of webinars that we've done. They're all recorded. And so if you go to bartonwebinar.com, you'll see a link to our YouTube channel. You can watch all of our past webinars. And I think I just saw my new friend, Olivia, I believe is on. I just chatted with her this morning, and I think it's her. I'm pretty sure. I'm going to look here. Hold on. It might be. It just says Olivia, but I had a really good chat with Olivia. She kind of shared with me kind of her story, her success with the Diabetes Solution Kit, what she's done since she began, and it was just wonderful. And so if you have a story that you would like to share, I'd love to hear from you. You can email leslie@bartonpublishing.com. One other thing I'm going to quick mention before I turn this over to Dr. Saunders to do some teaching. Oftentimes in this, you'll hear us reference the Diabetes Solution Kit, and that is this book right here. In this book, you'll find phases 1 through 3. And so we reference that a lot. If you do not have one of these, you may want to go to bartonwebinar.com and check it out. This is exactly what Dr. Saunders talks to his patients about in his office. And you can get this for a fraction of the price. So bartonwebinar.com, I'll post a link to that. But we're going to probably be referencing this throughout the webinar today, along with some other things too, but I'll post the links. Let's turn it over to Dr. Saunders. Talk to us about this pins and needles thing. What is going on?
Okay. So people often describe their neuropathy as feeling like pins and needles. And it's especially annoying at night. Can you imagine, like if you've ever had, like you slept on your arm and you wake up in the morning and it's numb, and then as the numbness wears away, you get those pins and needles, and it's just so annoying, and you got to shake your hand. Imagine having that feeling all the time and trying to sleep with your both of your feet or legs like that, with that constant pins and needles poking you all the time. That would be really hard to sleep. It would be so distracting. It makes it very difficult. And so that's where a lot of people come in. If they're walking around during the day, they say, okay, it's tolerable. It feels like I'm walking on pins and needles, and that's annoying enough, but I can't sleep at night. That's where they really get, this is a problem. So what's happening? What's going on here? Why does that happen? The nervous system is arranged kind of, it's really amazing how it's arranged. The cell has an axon, it's called. It's just like the wire, like the electrical wire. That you have a cell, and then you have this electrical wire that goes to where the sensory organs are. So like in the skin. And if you have something on your back, an itch on your back, that wire, so to speak, the axon, is about this far away from the cell. It's a few inches away. But if you go down the leg, that axon, the impulse that, like the wire, has to go from the cell is in your spinal cord in the back, has to go all the way down the leg to your feet, and that length of the wire has to have sufficient energy. It has to have what are called Schwann cells, or like it's like the plastic coating on the wire that prevents it from shorting out, kind of thing, and all of that has to be fed all the way down. So the longest nerves in your body are, of course, the ones in your toes, because the nerve cell is actually in the spinal cord, and then that nerve axon has to go all the way down to your toe, and it's to the sensory organ, and that's where you feel it. And so that's where you feel it. If you step on something, if you poke yourself, it has to travel. Oh, I just poked myself. It has to go all the way up to the spinal cord where the nerve cell is, and then go from there up to the brain. But that length of the axon, the nerve cell, has that really long length, is especially sensitive to a loss of energy. So if you're not getting oxygen to it, if you're not getting sufficient nutrients to it, that nerve cell is going to notice it first. And so that's what's really interesting, is that people will have it on both sides. If you only have it on one side, then it's probably something else, like a pinched nerve. Like you can have a pinched nerve, anywhere all the way down, and cause numbness and tingling sensations as well. So people can have it for other reasons. Diabetic neuropathy, you expect it to be on both sides at the same time. And as it sort of moves up, so it starts like in the toes, and then it goes into the feet, and then it goes into the ankle, and then it starts going up the leg. When it reaches right around the knees is when you'll start feeling it in your fingers, because that's the length of those axons, the nerve cells in the hands. So so the same kind of thing is happening all over your body. You just notice it first in the legs. And so when you notice it, then you know there's damage being done to the nerve cells. So why is that happening? Why are the nerves getting damaged? When the blood sugar is high for a long period of time, we talked about the blood-brain barrier. It's harder to get sugar across membranes when you have insulin resistance. And the crazy thing is that you can have this problem of insulin resistance and have normal blood sugars for an awful long time. So you could be technically not diagnosed with diabetes, and you could say, you could do some tests, and the doctor would say, no, your blood sugar's normal, you don't have diabetes, and have diabetic neuropathy, and have diabetic brain problems, and have kidney problems, and have heart problems, all due to diabetes. They call it metabolic syndrome or metabolic problems, before you ever get diabetes. And you don't even have to be diagnosed with diabetes. That's the weird thing. So that's dependent on different things. That is insulin resistance. So you can have insulin resistance for a long time and have normal blood sugar. So that's why it's so important to get the insulin resistance down. When we go through the Diabetes Solution Kit, we have a way of lowering the insulin resistance. So you go on a diet and you get rid of all of the carbs in your diet. So that brings your blood sugar down, and you're not eating enough sugar every day for your body to live on. So your body has to go, what am I going to use instead? Oh, I got all this fat. And so the insulin has to go down in order for you to use the fat. So your body will start using the fat. And the process of using fat brings down the level of insulin resistance and opens up those cells and allows more sugar to be brought in so the nerves can function better. So that's one of the reasons we chose for this a ketogenic type diet, so that you can get rid of the neuropathy and prevent brain problems and heart problems and kidney problems as well. That's one reason. The other reason is because blood sugar being high for a long period of time damages the lining of arteries. And the lining of the arteries is called glycocalix. And the glycocalix is really, really important. That is, it's like a fur on the inside. It's like, hair. It's literally like fur. And it lines all the arteries and allows blood flow to just flow straight through instead of like a pipe. A pipe, the blood or water, the fluid on the outside flows slower because it's like there's friction against it. This takes away all the friction and just allows everything to flow through. Well, what happens if you damage the glycocalix and things don't flow very well? You're not getting good blood flow. And as it gets more damaged, you get less blood flow. And then you can get clots, and the clots can prevent blood flow. So as time goes on, this can get worse and worse over time. And that's one reason why the nerve cells don't regenerate very well. They're not working very well. You can't send an impulse very well because you're just not getting the energy. Those nerve cells need quick energy. They got to work fast, and they need to recycle that energy fast. And if you don't have good oxygen levels and good sugar levels getting to those cells, they just don't work. Now, here's the cool thing. If you have neuropathy, pins and needles, even if you have numbness, this is a reversible problem. It's not permanent. Well, until it becomes permanent. If you wait too long, it becomes permanent. But especially early on, it is reversible. So there are several things that have been shown to reverse this. Yeah, many of you have tried the Nervala, which is our supplement that contains the two supplements that have been used to reverse diabetic neuropathy. One is alpha-lipoic acid, and that is an anti-inflammatory. So it gets rid of inflammation, especially in the cells that line the arteries, the endothelium. And then also the other one is a benfotiamine, which is vitamin B1, but it's a fat-soluble vitamin B1, so it gets into the cells easily that line the blood vessels and allows them to reproduce to make this glycocalix. So, but that's only a part of the issue. Some people think that they're just going to pop a pill and all of a sudden their neuropathy is going to get better. And many have, but it's so much better if you're working on the program. If you're doing the Diabetes Solution Kit, you're doing the diet, and you have very low carbohydrate diet, you're getting your blood sugar down, then you're not doing damage to the lining, and your insulin levels are going down so that you can get sugar into there, so things will start functioning better. So the nerves will start functioning better. So you're working on the blood vessels getting flow to the nerves, and you're working on the nerves to get them to work better. So these two issues will often reverse this diabetic neuropathy if it hasn't gone too far. Now, having said that, everybody goes, wow, that's wonderful. But why didn't it work for me? You know, that's always the question. Consider that there are other reasons for having neuropathy. That is, diabetes isn't the only reason. You can have a virus, the flu. People get flu shots and they get neuropathy called Guillain-Barré, which causes same thing, numbness, tingling that progresses up the legs. So this isn't the only reason for having neuropathy. People who get lead toxicity or mercury toxicity, other toxicities can damage nerves, or B vitamin deficiencies. There's vitamin B12, folic acid are common. And these are things that can damage the nerves as well. So ideally, you would want to know why you have the neuropathy. The assumption is just because you have diabetes and, oh, that's the reason why. And of course it might be, and it might contribute to it, but there might be more factors and other factors involved in that. Because if you have diabetes, then sometimes you have digestion and absorption problems associated with that. So there may be nervous system problems because of a lack of nutrients or toxicity and or the diabetes. So working with everything and finding out, is there any toxicity? Is there a nutrient problem? Or is it just metabolic? Is it just diabetes? And in which case, the Nervala with the diabetes program should reverse it completely. Isn't that amazing?
Yes, such good information. I did put up a poll for those of you who haven't seen it. It says, have you experienced this pins and needles feeling? About half of you that have filled it out have experienced this. So this is good information. And what I'm hearing is there isn't a reason to not do the Diabetes Solution Kit at this point. I mean, I feel like it always kind of leads back to getting your body healthy. And so, you know,
it's detox really, because the Diabetes Solution Kit, you're detoxing from the sugar. So that's why you eat very low carbohydrate diet, because you have to detox that out of your cells.
if you haven't filled out that poll, will you do that for us? We just kind of want to see where you guys are. Plus, I just figured out how to do it, so we should celebrate the poll. So here's
nice job, Leslie.
Thank you very much. Just did that on a whim there. Didn't know if it was going to shut Zoom down or not, but you know, I was willing to take the risk. All right, we have some really good questions that are coming in. Feel free to post yours in the Q&A there. Gary says, I don't have the tingling, but I do have swollen ankles. Is this related?
Okay, probably not. But possibly, but probably not. Okay, so the autonomic nervous system controls the dilation of your blood vessels. And so if your veins get really dilated, like when it's hot outside or something, and your veins are like huge, they leak more when they're dilated. And so a lot of people will use like compression stockings or something to put pressure on them to push the blood kind of back up to their heart, so to speak, because there's no heart down at the bottom pushing them up. So swelling can happen for a lot of different reasons that have nothing to do with the neuropathy. So most of the time, no. But sometimes, yes, because the neuropathy can affect your autonomic nervous system first, and which would then affect how your normal dilation of blood vessels, how your blood vessels work, and how your lymph system works to get the fluid back into your blood vessels and up to your heart again, and so it doesn't collect in your ankles. So possibly, but there's a lot of other reasons, possible reasons why that would happen.
Gary was also asking if Nervala would help with that. He did say there was a special for Nervala on Monday, and so he ordered it. He's hoping it will help.
Well, it might, because what Nervala does is repairs the lining of the blood vessels primarily. So, but it also helps the nerve. The alpha-lipoic acid is an anti-inflammatory to help the nerves, to stop inflammation in the nerves as well. So it has a dual benefit. But yeah, that might help.
Okay. Today in one of our team chats, I posted a message about how I was seeing some ads for diabetic shoes. And I'm just curious what your thoughts are on good quality shoes to be worn for someone who's experiencing neuropathy.
Oh, yeah. Okay. So shoes can be really good for you, and they can hurt your feet too. So quality shoes are kind of important. There needs to be ample room in the toes, especially, and having so that you're not going to create a problem like ingrown toenails from pressure on the side too much, for example, because if you don't feel something, then you won't know it's there. And many people have had to have amputations of their feet. And the problem is not that because of the neuropathy specifically, it's because they get an infection and they don't feel it because their foot is numb. And then the infection gets into the bone, and then they can't heal the bone, so they have to do an amputation. So checking your feet periodically and making sure you have shoes that fit properly, that aren't wearing away and creating areas that you might get infections, calluses and stuff like that.
Okay, good information. Juliet is asking, what about the leathery feeling under the feet? Will that go as well, or do I have to do something else for that?
Oh, that's interesting. Yeah. Thank you for asking about that. That leathery feeling where it feels like you're walking on something is generally from either edema, swelling, or the neuropathy. And the reason for that is the pain, like the sharp and the temperature nerves lose sensation first before you lose the pressure sensation. So that the sense of pressure you still feel. So you're walking on and you don't feel any of the points, and you don't feel the temperature, but you feel the pressure. And so that's the leathery feeling that you get on the bottom of your feet. But yes, that should go away in both cases, whether it's from edema, which can give it that sensation, or if it's from neuropathy. Yes, that should go away.
Okay. How about Don is asking if chiropractic adjustments would help?
Oh, that's interesting. I don't know. If you're having an issue due to like a pinched nerve from the back, that's possible. That might be helpful. You know, it's kind of interesting that we have these two different modalities, even though they're kind of doing the same thing. This manipulation of the spine to improve nerve conduction. So the chiropractors look at it as nerve conduction, but the osteopathic physicians look at it as blood flow, as improving the flow of blood to the nervous system. And so it's like two different ways of looking at it. So if you have that problem, then yes, the chiropractic adjustment might be helpful.
Okay. Jill, this is kind of a question for you if you're able to answer, maybe not, but just someone was curious when the last time the Diabetes Solution Kit was updated. I'm going to say a couple of years ago. I don't know.
It was about 2 years ago we did it.
Yeah.
Yep. Yeah. 10th edition, I believe, was 2021 or 2020.
Yeah. Okay. Let's see. Krish, welcome back. Are the terms diabetic neuropathy and peripheral neuropathy the same and refer to the same condition? Yeah.
Oh, okay. So diabetic neuropathy is a cause. In other words, we're saying your nerves are not working because of diabetes. So that's a because of. So that's a cause. Peripheral neuropathy is a location. So peripheral neuropathy is in the periphery, meaning the central part is your body and the periphery is your arms and legs. So peripheral neuropathy just means it's in your extremities, your arms and legs, and not in your body. Interesting.
Okay. All right. These are great questions, you guys. Let's see. How's our poll doing? About the same. We still got quite a few of you that could fill it out, though. Okay.
50%.
Yes. Let's see. Okay, so here's a question from Robert. He watched our video on vision loss and stem cells, but he's still a little bit confused. He says, please reiterate the 3 steps needed to reverse vision loss. Do you remember the 3 steps?
3 steps. Let me think. Okay, so but what would I say to reverse vision loss? Okay. I don't know that you can reverse vision loss. If we're talking about like glaucoma, yes, you can reverse that. So you need the right nutrients. You need your blood sugar to be normal. If you're losing your vision, your blood sugar needs to be normal. Your blood pressure needs to be normal. You need to have the proper nutrition, and Nervala might work for that. But there was an article I wrote for the Home Cures That Work where we talked about glaucoma specifically and using vitamin B3, niacinamide is often helpful for that. But getting enough of all of the astaxanthins and zeaxanthins and carotenoids, beta carotene, all that stuff, vitamin E, zinc. So they have like specific eye vitamins for reversing vision loss, and then controlling the blood sugar. I can only think of 2: nutrition and controlling your blood sugar.
Okay. Let's see. Mary says, if you are taking Ozempic and have type 2 diabetes, can you increase your dosage from 0.25 milliliters to 0.5 milliliters and not take Metformin?
Well, you could probably keep it the same and not take Metformin. This is one of those things that you're going to discuss with your doctor because it depends on so many things like What is the output of insulin from your pancreas, and what are your blood sugars running generally, and do they spike, and stuff like that. So yeah, if you need to get off metformin, then that's definitely something to bring up with your doctor, whoever's prescribing the medications for you, and say, well, what happens if you stay on the same Ozempic and just not take metformin? What happens? Those are the kinds of trials that I would do, is just find out what works for you.
Yes. Okay. Question from Greg. Can you speak about carb flu when starting a low carb diet? Your body's reaction to starting this diet?
Oh, that's really interesting. There's a keto flu, people starting a keto diet, and there's a carb flu starting a carb diet. Or that's what he's talking about, right? A low carb diet is going to get the keto flu. Yeah, that's a funny thing that happens when people are on they're eating a lot of carbohydrates. They stop eating carbohydrates, and they get flu-like symptoms, and it's kind of like the flu, where you get aches all over, and you don't feel good, and you get headachy, and you don't have. And you want to lay in bed all day. It's one of those kind of things. They call it the keto flu. It's not from making ketones. What happens is your blood sugar gets low. So it's kind of a simple concept of a thermostat. If your thermostat is set for 75, this actually happened to me. My thermostat set for 75 degrees. It's like 80, 90 degrees outside, the last week. And it's set for 75 degrees. People walk in and they say, "Ooh, it's cold in here." Okay, it's 75 degrees. And they say, "Ooh, it's cold in here." I actually had one patient say that she prefers it to be higher. But let's say in the wintertime, when it's 40 degrees outside, 50 degrees outside, and they walk in at 75 degrees, what are they going to say? They're going to say, "Ooh, it's warm in here," right? So that's the way your blood sugar works in your body too. It's the same thing. This is a biological system, just like temperature is a biological system. And so if your set point for sugar, glucose in your blood is, let's say, 150 to 200, and that's the range that it stays in all the time. And then you go on this keto diet, and all of a sudden your insulin is down, your glucagon is down, your blood sugar is dropping down, and now you're in the 120s when you're used to being in the 150s. Then you feel like you're not getting enough sugar, you don't have enough energy, you're getting achy all over, getting headaches, you can't think straight, brain fog, all that stuff happens. What is it? It's hypoglycemia, low blood sugar. But if you actually test, or if you have a monitor and you're looking at it, your blood sugar is even high. Your blood sugar is 140. But if you're used to being 200, then you get that keto flu pretty easily.
Okay. Couple questions here about having pain and tingling in one leg only. Is that common?
Not common. I mentioned that. That's kind of an important thing to look at and say, "Hey, I only have it in one leg. Why?" Okay, two possible reasons. One is that you have a weakness on that side of some kind, whether that's a blood flow, a lack of blood flow, more on one side than the other, or you've had an injury on that side in the past, and you have nerve damage from the spine or something like that or a surgery. I actually had a case where somebody had sciatic on one side, had surgery, and then later on got neuropathy. And he said, "Well, why is the right one getting better and the left one's not getting better?" It's like, okay, because you have a weakness on that side. So one possibility is you have a weakness on one side. The other possibility is it has nothing to do with diabetes at all, and you're getting the numbness and tingling because there's a pinched nerve and there's a problem. So you're finding that out is the first thing to look for, because if you have it on one side, then you might need some medical attention to take care of that problem.
Okay, Mary and Don, I hope that helps to kind of answer your questions. Let's answer this one here from Glenn. Is numbness in the toes also considered neuropathy? I feel like my socks are bunched up between the toes and the pad of my foot. I have been taking Nervala for quite a long time, and the tingling in my arms while sleeping has stopped, but the numbness is maybe 30% better. Would the magnesium spray also give any help to this numbness?
Okay, yeah, that sensation, like your socks are bunched up, and that's the feeling that I was talking about before, about the way the nervous system works. You actually, the sensors for pressure will last longer than the sensors for the tingling and the temperature and sharp points. So you feel the pressure, but you don't feel the temperature. So your feeling is not normal there. It sometimes can take months for it to come back. The fact that you got improvement in your hands and some improvement in your feet is a good sign that this can come back. Make sure you're getting your blood sugar down to normal, and hopefully that will come back. It doesn't always, it depends on how far gone the nerves are, but nerves can regenerate. So give them a chance, do the 6-10 reset, keep your blood sugars in the normal range, and then continue to take Nervala. And I would try one other thing. So if you had come into my office and said, I have this problem, my toes are just still numb, they're still nummy all the time, I would give a series of vitamin B12 shots. And it's just because vitamin B12 is good anti-inflammatory for nerves, and I've just seen it work several times. Many times I've seen it work. So I would do a series of, I don't know, 8 or 9 or 10 shots once a week for 10 weeks kind of thing, or twice a week for 5 weeks, something like that.
Okay. More good information. Dr. Saunders did mention the 6-10 reset. So if you're kind of wondering what in the world are you talking about, it's going to bed by 6. I'm sorry, no, stopping eating by 6 and by 10. I mean, you can go to bed at 6 if you want. But we do have webinars where we've talked about this. So again, if you go to bartonwebinar.com, you'll find a link to our YouTube channel. You can search 6-10 reset. You'll be able to find all the information about that. There are also links to the supplements that we've talked about. I think we've mentioned Nervala mostly today, but there are other things there too. So bartonwebinar.com will be a good resource for all of you. I'm reading and talking at the same time, and I should know better. Okay. Let's see. Krish said his question was about vision loss and glaucoma that you had responded to. But his question now is, how much niacinamide can one take? As he read that high amounts cause unwanted cardiac events.
Okay. So niacinamide is actually extremely non-toxic. It's a B vitamin that's water soluble. Your body will get rid of whatever excess. And there is a difference between niacin and niacinamide. And niacin has to be made into niacinamide. And in the process of doing so, it does certain things like lowers your cholesterol, raises your HDL cholesterol. And so it does and can affect your heart. Niacinamide, on the other hand, has been used in doses of, you buy a pill and it's 500 milligrams. And there was one case of somebody with schizophrenia who reversed the schizophrenia taking niacinamide, was taking 40 grams a day. That's 80 pills a day of niacinamide. And there have been lots of studies in the orthomolecular literature using niacinamide in 10 grams and 20 gram doses. So niacinamide is pretty much limited by the number of pills you feel like taking. But just remember that you don't need that much. Most people who don't have some strange abnormality of an enzyme that requires high doses of niacinamide, most people do really well just taking 500 milligrams 3 times a day. That's a very reasonable amount.
Okay. Juliet is asking if there's anything I can take to help with floaters in the eyes.
Yeah. Well, no, not specifically. Floaters are kind of like folds, like your eyes full of jello, right? And this gelatin. If you ever play with jello, and you can cut a knife through the jello and it goes right back together. And you can't really see where the cut was unless you look at it at a certain angle where the light can reflect off it. That's kind of like what's going on in the eye, where there's little separation of the gelatin from the side wall of the eyeball, and that creates a reflection, for example. Or inside the eye, there's inside the jello in the eye, there's a little cut or a fold. It kind of like folds over. So that's what's happening with the floaters. And so the best way to manage that is to keep your eyes full, to make sure you have enough protein in your diet. You're getting enough of the proteins that make up collagen, keratin, and that make the gel inside the eyes. So getting enough protein, getting enough fluid, and having the right level of blood sugar, because what happens if you've noticed, when you have high blood sugar, your eyeballs actually swell up, and that's why your eyeballs change. And so if you go into an eye doctor and your blood sugar is 500 or 300 or something like that, they're going to go, no, we can't examine you with the blood sugar of 300. You have to get your blood sugar under control and then come back. Why? Because you're going to have a different prescription with a blood sugar of 300 than you're going to have a blood sugar of 100. So then what happens is that it swells and then shrinks down. The actual size of the eyeball changes. And in the process of doing that, you get folds. So keeping your blood sugar pretty stable around 100 is a good idea too.
Interesting. Okay. Let's see. The Garcias are on. This is Vilo. I was diagnosed several years ago with peripheral and eventually diabetic neuropathy, even though I did not have and still don't have the pins and needles feeling or pain. I only had and still have, to a degree, numbness. The neurologist found that my problem was sciatica with a very slight pinched nerve, but he did say it could also be from diabetes. The areas affected are my right side of my abdominal area, lower back, right leg, right arm, shoulder, and hand. It seems that Nervala has helped a bunch. My right leg is weaker than my left. Is there anything else I can or should do?
Oh, yeah. So that's interesting. So the neurologist says, the neuropathy is right-sided everything from the upper extremity to lower extremity, the hip. So that means that there's something anatomically wrong. This isn't a diabetic neuropathy, and the neurologist is right. So the diabetes can contribute to it, but it's not the cause. So Nervala can help, but ultimately exercising and then finding out why. If the neurologist says there's a pinched nerve somewhere, why is that there? And how can you unpinch it? What can you do? Physical therapists can often be helpful for that, because you're looking at an anatomical problem, so it needs to be dealt with in an anatomical way. So the Nervala is going to help like the metabolic part and get the blood flowing and get the nerves to repair. But if you still have an anatomical pinch in there, you still have to unpinch it to allow the nerve to work properly. It's interesting. Okay, right side. Can I just say something about this, Vilo? I had somebody come to me with a right shoulder problem. It's like his shoulder was really hurting. He couldn't like lift up his arm, and he was having trouble driving. So I asked if he didn't have any injuries or anything. So I said, okay, let's look into why the blood flow has stopped. When the right side of your body represents something in your brain, and that is the right side is power and masculinity. The left side of your body represents support and femininity. So I asked him about his and shoulder is a loss. So I said, some loss of masculinity or loss of power. He goes, oh my gosh, I lost my job. Yeah, it's been over a year. I haven't been able to find a job. I'm driving for Uber and I just can't support the family. My wife's supporting the family. It's just a horrible situation. I'm going, aha, there's your problem. That's why your shoulder is hurting. So I saw him a few weeks later and he's look, no problem. Everything's functioning. I go, what happened? He goes, I got a job. And so he was working, he was happy, and he said within a day of getting a job, shoulder pain was gone after months of suffering with the shoulder pain. So you have to consider, was that Joe?
Yeah, I just said, wow.
So you have to consider when you're looking at this, that why is it only the right side of your body? You have to ask the question, why? What's going on the right side? Is there an anatomy problem or is there an emotional problem? And look into that.
It's very interesting. It's got me thinking about lots of things. All right. Let's see. Glenn says, are the B12 shots in the feet? Is this approach best?
No, don't do them in the feet. Just like, B12 shots, just like in the muscle, just like a shot, or in the butt. Yeah. Just like.
And how would you say is B12, are the shots better than taking it like in a supplement type or pill?
Yeah, that's a great question. Thank you. Yeah, the reason for shots is because if you take an oral supplement, I had somebody using a B12 cream, you get such tiny amounts. I mean, we're talking 10 micrograms are you're getting from the sublingual or the creams. And the pills, you take a milligram, but you're actually going to only absorb like 30 micrograms of it. So it's not like you get it just because you take a pill. B12 is very hard to absorb, and a lot of people are deficient in it because if you have stomach problems, then your stomach stops making something called intrinsic factor, like if you have ulcers or gastritis or something like that. And you have to have intrinsic factor to bind to the vitamin B12 so that you can absorb it down in your intestine. So if you don't have that, then the B12 the intestine doesn't recognize it and goes right on through. So how are you going to bypass all of this? Well, shots. Okay, so they say the creams can help. Yeah, you're still getting microgram quantities, tiny amounts, and not enough to really be anti-inflammatory. So yeah, shots, 1 to 5 milligrams. The first shot I give to people is usually 5 milligrams. That's 5,000 micrograms. And yeah.
Okay. Let's see. I think Joe has brought a few special guests.
Yeah.
Yes. Aww.
Who needs some kittens? We've got 5 kittens ready for new homes.
Oh, I want one.
Okay.
Can you put one in the mail for me?
I'll mail one out to you.
I asked my kids, what they missed the most. We used to live on an acreage and we moved actually into town this year. And they don't really miss the acreage. They miss their kitties. So sad.
Yep. Here they are. Here's my
Oh,
dog.
they're so cute.
Yeah, they're pretty cute right now. They're friendly too.
So fun.
So if anyone lives within 100 miles of South Dakota, come on out. We'll give you a free one.
Olivia, I'm allergic to cats too. These are outdoor ones. Yeah, and Velo and Barbie, they're allergic too. Oh,
Same here. That's why they stay outside. They're great mousers, though.
Yep, that's why we have them also.
I better turn it off. I'm becoming a distraction.
Let's see. I have one more question here, and this is from our friend Bill Davenport. I have had neuropathy twice in the past. 8 years ago, I was on Metformin, and my doctor never told me that it crushes B12. Is that true?
No, it inhibits the absorption of B12. Yeah.
Yeah, I think we've talked about that before. The neurologist said that when your B12 is that low, you get nerve damage, and put me on B12 pills, and it was gone in 2 weeks. 2 years later, I got neuropathy again, and a diabetic friend recommended CBD oil. And after taking it for a week, it was gone and it never returned. I since learned about Nervala, and I take it regularly to heal eye issues. That should help, right?
Yeah, that should help. Yeah, that's really good. So the CBD oil works entirely differently. It actually works on the nerves and is a great anti-inflammatory for nerves. So people who have like inflammation in the nerves, and the Nervala has the alpha-lipoic acid that has the same, well, not in a different way, but also decreases inflammation in the nerves. So that it's interesting that the CBD oil worked well. However, if you've had in the past neuropathy from low vitamin B12, be sure you're still taking B12, because that still is a potential issue. So, because you can cover up a neuropathy with something like CBD oil, you can cover up and allow the underlying damage to continue from the lack of vitamin B12. So I would just recommend taking the B12.
Yeah. Okay. I think we had a question similar to this last week. Eric says, hello, my weight was at 237. I'm now at 197. And when I get 190 pounds, what do I do to keep from going any lower?
Oh, to keep from going, well, work out, build muscle. Muscle weighs more than fat. And so working out, getting big muscles is a great way to keep your energy up, your muscle mass up, your weight up, and it prevents you from getting diabetes or going back into diabetic neuropathy or whatever.
All right. Juliet says, if I do the 6 to 10 fasting, my sugars are higher in the morning. Will that affect the floaters? Or should I stop the 6-10 fasting to keep my sugar levels lower? Not sure.
Do the 6-10 fasting. That's fine. Those minor elevations in sugar levels because that's from glucagon. That's not from what you ate. So I would totally stay with the 6-10 and it's okay to have a small elevation in blood sugar from that.
All right. Sue was told that you can overdo it with B vitamins, which can cause neuropathy. Should this be constantly checked through a blood test?
Yeah, no, well, yes, you can, but you don't have to check with a blood test. The best way to do it is to take it periodically. I do check people's levels, and when they're really high, I say, you know what? Take your vitamin B12 once a week, take your folic acid once a week, or take your B complex once a week. It's pretty hard to overdose if you're taking them once a week.
Okay. Okay, I think that's it. Diane, how much B12 should I be taking?
About 1 milligram. 1 milligram a day, or 1 milligram a week if you have high levels.
Okay. Okay, I think that's actually it for our questions. Our poll came out, 50% said that they had experienced pins and needles, and 50% said that they had not. So very interesting. I'm glad we chatted about this, and it looks like about half of you filled the survey out. So good information today. This has been really good. Thank you all for all of your questions. And Dr. Saunders, thank you for all your teaching. Anything else you would like to leave us with before you head out and see patients?
Well, just remember that a lot of times we discuss, taking a vitamin B12, taking this vitamin or Nervala or whatever. Just remember that those are important adjuncts, and that as we're working with even the pills, those to us are temporary. You're only going to take Nervala until your neuropathy goes away. We just want to reverse that problem and then not have to take it anymore. And that would be the same with most of the supplements. I still take Synachroma because the combination is it's a good combination that then there are nutrients that you can't get from your food. So I like that. So I take that, but it's not something you have to take all the time. So it's not about the supplements so much as get your blood sugar under control, detox from all that sugar, go on take the Diabetes Solution Kit, go on phase 1 and do the detox, get rid of all that toxic excess sugar and fat that's hanging out. And that's the way to really heal this. And all of the other stuff, the pills are adjuncts.
The other day, Dr. Saunders, we talked together, and something you quoted somebody, and I don't remember exactly how it goes. Maybe you could share that, but it's like medicine.
Sir William Osler.
Yeah, different therapies.
He said the difference between man and the animals is man's desire to take pills.
Yeah, that was one of them. The other one was basically how distracting yourself so that your body heals itself, right?
Oh yeah. That was Voltaire. Voltaire said the art of medicine is keeping the patient busy while nature heals the body.
Yeah, I thought that was interesting. So yeah, we talked about too, like, we don't want people to be on our supplements forever. It's more like, let us be the bridge that gets you from a disease state to a healthy state. And, using the information that you learn and answering your questions, and then making changes and maybe adding some supplements to get deficiencies taken care of and things like that. But like, our goal is that a year from now, we don't even see you anymore. Like, you're off living your best life and, feeling healthy and yeah, like no limits. And so we want to hear from you every once in a while, just because we make friends, but we want you to be feeling like, all right, I'm good. Like, my body
independent.
What's that?
We want you to be independent.
We want to hear your success stories.
Yeah.
We want to hear about how good you feel.
Yeah, we want to see your video testimonials when you're out on a cruise ship or playing pickleball or something like that. So, yeah.
Awesome. Thank you, Dr. Saunders, so
All right.
much.
You're welcome.
So appreciate
Take care.
you. See you next week.
Bye.
Couple things I'm just going to let you guys know about. When I was chatting with my new friend Olivia today, she had asked if we had gotten together for a retreat in August, because we had talked about that quite a few times on the webinar. And I was just going to let you guys know that we did not do that. We delayed it. We're going to kind of reevaluate and just kind of see what will work best for everyone. We still, of course, would like to, but there's just a lot that goes into making that happen. So to be determined.
And my son was getting married at the end of July. So it's like, it probably wasn't the best timing to be playing retreat at the same time as that. So yeah, a lot of different factors.
Yep.
Plus, I think I'd rather be in Arizona during the winter time than in August. So.
Yes. We got a lot of feedback from people saying that. And I agree. I would too. So Another thing that I just posted was, if you guys have enjoyed working with us or have found success with our products and would mind giving us a Better Business Bureau review, we would be grateful. I just posted the link there. It'll tell you what to do, but we still appreciate that. And it does help others when, they want to see if we're actually a legit company, if we're actually real people. A lot of times they'll go here, and if someone thinks that we weren't and they give us a bad review, then other people think that we're not real. So promise we're real. I'm not a robot. And this is a real webinar. So we'd appreciate it.
And also, if you're watching on the YouTube, click that subscribe button and the little bell to get notified every time we put up a new video, to get notified. And we have posted a few workouts with Mariah, our friend who is studying to become, she's getting her master's in, I think it's like athletic training or sports coaching. I can't remember exactly. She's doing a lot of functional, high intensity interval training, short workouts, 10 to 15 minutes. And it's designed so that anybody at any, ability level, age level can do it. And so Velo and Barbie have been our guinea pigs. I've been sending that to them privately, and they've had glowing reviews. And so you can find that on our YouTube channel called Movement with Mariah. I think we've got 7 of them uploaded now. So check those out. You can do a new one each day of the week. And we're going to have probably over 30 of those by the time we're done. She's still cranking those out. So, and give us feedback on those too. So, but that's important, is getting that body moving every day, several times a day, all day long. I'm dealing with, I woke up with a little lower back issue. I think I was working out too much, too heavy on Friday. So my trainer, Jim, I go to the gym, and he knows how to motivate me because I'm a big Minnesota Viking.
He goes to the gym, and his trainer's name is Jim. Okay, so cleared that up.
He motivates me by telling me like, all right, Joe, the Vikings aren't going to make the playoffs unless you get the set done, and do 12 of these or whatever. So I'll do like 13 or 14, of course. And so it's just kind of a fun little game. But I think I went a little too hard on Friday. So I woke up Monday and my back was like whacked out, like my lower back. And I felt like an old man walking around, like I needed a walker. And my wife is looking at me like, what is going on? So, but what helps it is just like getting up, moving, walking around, stretching, like just going after it instead of resting it. Like, there's pain there, but like you kind of want to embrace the pain and know that the pain means your body is working on itself. And so putting yourself into that position and embracing it. And I feel great right now. I'm down here playing with kittens, so.
That's the thing too, is sometimes we forget that the body was created to heal. It was created to heal itself, and it has the ability to do that if you let it.
Yeah, I want to read some of these comments coming through here. So let's see. Good interaction. All right. You want to read through some of these lists of these chat?
Yeah. Eric does want to let us know, or want us to let him know when the next retreat will be. So we will definitely do that. Vila and Barbie said the HIP program has been great. And Jill, where do we request the notifications on the new videos, please?
The new videos, so I think that is YouTube. If you just go to YouTube, there's a subscribe button and then a bell. I believe you click on the bell, and that will notify you when we post them on YouTube.
Yep.
But otherwise, if you go to bartonwebinar.com and sign up on Zoom, then Zoom sends out an email before we're going live, like we're live right now, and then you can join live and get your questions answered by the doc. So
there was a message here. Sue says, I'm moving to Florida, Dr. Saunders, to see you. So, and actually he isn't in Florida, but I would move to Florida if I was you. Dr. Saunders, he's actually, Santa Barbara-ish is probably where you could actually go. him.
Yep.
The YouTube link. You know what? I'm just going to tell you to go to bartonwebinar.com. That's the best place to go to get a link to the YouTube channel. I'll post that here. bartonwebinar.com. And if you have a friend or someone you think might want to check out these webinars, they're also posted on Facebook, but send them the YouTube link as well. There's a lot of good information there.
Yeah. And you mentioned the Better Business Bureau reviews. I think we probably tend to just get the negative Nellies that show up there. And so most people don't give any feedback unless it's negative. So it's kind of nice for customers that like us to leave, positive reviews at the Better Business Bureau, which I'm not a big fan of the BBB, and we don't really use it that much, but some people look at it to see if they can trust us or not. But the BBB is sort of a marketing scam in a way. Like that's a whole nother topic, but.
Also, if you have, if you're open to sharing your journey with me, I would be grateful. We've had a lot of people that have had success with the Diabetes Solution Kit or some of our supplements. Maybe it's the webinars that have really helped you a lot. I would love to hear from you. If you could email me, leslie@bartonpublishing.com, I'd be grateful. I've had a lot of fun getting to meet some of you, and it's so fun when I see your names pop up on the webinar and I'm like, oh my gosh, I know them. I saw them in person, sort of on the camera, but
yeah,
cool. And then I get to know that you're real also, right?
Yeah, we love that. You're doing great with that, Leslie, by the way. Keep up the good work.
Thanks, Joe.
Even though you have to kick your husband out of the office for, a couple hours when you do that.
Oh, he just tried to reappear right now. He's very frustrated with me that I'm still in here. Both of us tried to do video calls at the same time, or if one of us is typing, the other one can't be on a video call. And so it's like, all right, I think our days of sharing an office are over.
Tyler, you got to improvise.
You who don't know, my husband actually works for Barton Nutrition as well. So
yeah, you can thank Tyler for picking up Kevin's sample packet of Fiber Greens iced tea lemonade that he took both of them instead of leaving one for Kevin. So that was a real good one, Tyler.
A new Fiber Greens flavor, guys. Did you hear that?
Yeah, it's really good. We got samples. We're going to have a new flavor. And one of the reasons we did it was because Dr. Saunders doesn't want the taste. He talks about the taste of sweet, that there's insulin from your pancreas, and too much insulin is a problem. And so we're trying to reduce the sweetness, but it still tastes really good. It's got lemon and tea, and it's not too sweet, and it tastes good. And so the green apple is our regular flavor, and that's good too, but it kind of tastes like a green apple Jolly Rancher. So that probably has a little bit more insulin response than we would want. So we'll probably be pushing the iced tea lemonade flavor more in the future. But we do have a lot of green apple now in stock, Fiber Greens. Check it out at bartonnutrition.com. And did we tell them about the coupon code?
No, we did not.
Do that. Webinar 5. Webinar 25 saves 25% off your order at bartonnutrition.com. And we'll even send you a free kitten.
Don't say that.
Where are they? They're all took off on me now. So, and I just stepped on a dead chipmunk. That's great.
See, real people, guys. All right, code webinar 25 to save 25% at bartonnutrition.com. I just posted that there for you guys. Okay, anything else we didn't cover? Vince says, this was my first webinar. I'll see you next week. Welcome, Vince. You made it to the end, even through our strange chatting about weird stuff and kittens. You're still here. Good job.
Way to go. All right,
awesome.
Let's start with kittens. Can you see that little guy?
Oh, kittens are the best.
Yeah, they're pretty cute. Hey, guys.
Oh, my goodness. All right, guys, we better get going. Have an amazing day. We'll see you guys next week. Thanks, Joe. We'll see you soon.
Bye, everyone. God
Bye-bye.
bless.